for me, it comes down to a very strong sense of collective identity. What flows from that collective identity is we're all in this together. And when you're all in something together with a shared hardship, and this state has known more than its fair share of hardships. As I point out in the piece, there's no question that there is an element of scale and logistics here, no question. And when you look at the states that are ahead, the smaller states like Alaska, with lower populations are leading the pack. So there's no question that when you're smaller, you can be more nimble, as I point out. But I think there's a related piece to that I don't think we've sufficiently emphasized, which was really the message of the piece, which is that when you're smaller, you do tend to know each other. Those community connections are going to be much stronger. And when surveys look at why do people hesitate over vaccines, most of the issues are trust issues. They don't trust how the vaccine was developed. They feel it was rushed. But those same surveys show that who they do trust consistently and by far is their own healthcare provider. In the piece, I point out that I think what we perhaps almost stumbled upon, because we had to work with the community pharmacies for logistical reasons. There's far more of them than the chain pharmacies, and they're more evenly spread throughout our state. But when we did that, I think we hit on something else. And that is that these are people born and raised often in the community. You know them, you maybe went to school with them. And so when they come to the long-term care facility and are members of the community and say, look, you know me, I'm from here. You can trust me in this ultimately very intimate act, right? At the end of the day, there's an intimate act of someone sitting down and allowing this esoteric substance to be injected into their arm. That's actually an act of trust.
I'm extremely proud of all the local pharmacies in West Virginia that have really pulled together to roll out the vaccines as quickly as possible to the nursing homes, to medical providers, to teachers. It really is a tremendous effort for everybody to have chipped in to do what we can.
So I'm certainly not an opponent of opening up a giant football stadium and do a mass vaccination clinic. If you're comfortable with that and don't have any hesitancy about vaccines and that's convenient and fast, great. But we also have to be sure that we're getting it to the primary care providers at the community level, into the local pharmacies, to the people of trust, because as doses become more available in the months ahead, we're going to see the increasing vaccine hesitancy declare itself. Early on in this pandemic, we were extremely concerned about the impact on West Virginia because we know that the risk factors for poor outcomes with COVID-19 are factors like age, most powerfully, and we are typically the oldest, or tied with Florida for oldest state in the United States. Florida is old because old people move there. We're old because our young people are leaving the state, so for very different reasons. We were worried as an older state with high rates of chronic diseases that are known risk factors for adverse outcomes with COVID-19. We were extremely worried early on. Thankfully, We haven't exceeded our hospital capacity. We haven't had the nightmare scenarios that we feared. There was a palpable fear here that we had to be on top of this. We had to address this very effectively and comprehensively. And again, I think when you're worried about the outcome, it really motivates people to work together and put aside any kind of issues to collaboratively deal with a problem. We have to have a collective approach. Any way that we can get people to understand that their actions impact others and to see those connections is critically important.